All right, so sorry, YouTube people. I just realized that, um, yeah, there's a few different steps with zooming to live streaming from Zoom to YouTube, and I think it should be live now. But yeah, so sorry about that. Though you didn't miss. The only thing you missed is the challenge that I'm having. So I won't go over everything. You could look at the bullet points. But anyway, with Zoom, I have to click something to live stream, but then there's a go live button as well. And I forgot to click the go live. So I was wondering why there were a bunch of people waiting. So I apologize. Um, but again, the challenge, I'll leave the slide up. So again, just briefly start for those on YouTube. Again, apologize. So I'm having a 21-day Graves and Hashimoto's challenge, starts on November 2nd. And again, you can read all this. Visit the website for more information. And what was I going to say? If you have questions on this, definitely ask during the challenge. Again, pretty much it's 21 days straight. The video lessons will be pre-recorded, so it doesn't matter where you live, whether you're in Europe or United States. And there'll be daily coaching calls, and the times will vary, typically 1 p.m. or 8:30 p.m. Eastern time. Again, might rotate, might change the times slightly on some days. So some days might be 12 or, yeah. So anyway, cost is $49. An optional Find Your Food Triggers call for $50. But and then there's a community on Facebook and one off of Facebook. So there's actually two communities. And so anyway, definitely visit the website for more information. But again, I apologize, YouTubers, for being late. Let me. All right. So again, any questions, whether you're on YouTube or Zoom, go ahead and put it in the chat. And all right, so let's see here. All right, and we have Lori from Chicago. Yeah, I'm bad about that. I need to, yeah. So feel free to let me know where you're from. It's nice seeing people from different states, different countries. So all right. So Tom, how do I get caption? I'm hard of hearing. I do not know how. Yeah, I apologize. Let's see. Is there anything? I don't know. Yeah, I might have to look into that, Tom, because again, as you can see, I'm not. I've done a number of these, but still couldn't remember to go live on YouTube. So, I'll have to. Yeah, I'm just gonna have to make a note to let's see. Yeah, see, I don't know if there's a way to do it automatically with Zoom. You would think there is. And if anybody else on the chat knows, just let me know. Let me actually scroll down. Maybe someone actually. Let's see. Captions have to be typed by the host if it's a live meet. Really? Has to be typed by the host. Okay. So, and then someone else says see meeting settings under the 3-dot menu. Okay, so I don't know if they could do it, if that's what you mean, CT. So see meetings, so under the 3-dot menu, which, oh, actually, let's see. So under the 3-dot menu, yeah, I don't know. I might need to go to, actually log into the account or something, which I can't do right now. But yeah, I don't see anything. So I apologize, Tom. I will look into that for for future chats, and also good to know for the challenge as well. Okay, so And then Carmen, you send questions to the email, so I would retype it here. You know, I only pretty much for these questions. For one thing I should mention for the challenge, that's another difference between the challenge that I'll be having. The daily live call, like with these Zoom calls and all that, I just pretty much answer live questions. With the challenge for the daily coaching calls, the same thing. I'll just answer live questions. But with the weekly 90-minute Q&A sessions, you could email questions, which has worked well. With previous challenges, I just pretty much display the questions to everybody and go over questions. But for these live calls, I have a difficult enough time getting to all questions. Usually I don't. So anyway, so Carmen, I would definitely type in the questions that you emailed. All right, so let's again bring up the chat here. And all right, so Brock, have you ever dealt with iodine-induced hyperthyroidism? Yeah, a few times where someone has, that's the controversy with iodine too. So, which I won't get into great detail with that, but iodine, it doesn't cause hyperthyroidism, of course, in everybody, but in some cases it could be a risk with that. So, and usually, so iodine is important for the production of thyroid hormone. So for some, it might make sense. So you take, a lot of iodine, you can get hyperthyroidism, but again, it's not always the case. There could be a few different scenarios. So one, could be with, again, it could be too much thyroid hormone causing hyperthyroidism, but that's not typically what iodine, a lot of people don't, too much iodine can cause oxidative stress. And, so that possibly could lead to hyperthyroidism. But also one thing that sometimes happens is with, and actually a recent patient, I've had this where she, recent, actually earlier this year. So it was but anyway, so she was seeing a naturopath who recommended iodine, and, she became hyper. And what seemed like it was happening to her, she developed Hashimoto's. So Hashimoto's is, it's Hashimoto's, but you have hyperthyroidism. What happens in her case is the iodine caused it pretty much, I don't want to say triggered autoimmunity, because usually there's something else underlying. I speak about this a little bit in my book, Hashimoto's Triggers, but the iodine, if whether you want to use trigger or exacerbated the autoimmune response, so immune system, attack thyroid gland, and with Hashimoto's, and I do have an article on my website on Hashimoto's, so you could visit my website and do a search for that. And what Hashimoto's, immune system attacks thyroid gland, and even though it causes damage to the thyroid gland, it also can cause the release of thyroid hormone into the bloodstream, causing hyperthyroidism. And with this person that I've been working with, she actually, this happened a few times. More recently, again, I think it was actually late last year. So like in her case, our goal is to try to address autoimmune component, and then doing things if someone's still hyper, increase antioxidants, improve immune system, increase glutathione, which is the master antioxidant. So I can't say it's common where like most of my patient base is not due to iodine-induced hyperthyroidism, but it is something I've dealt with. So Lori, I'm on Synthroid, 75 micrograms. Do I have to also be on metformin for blood sugar imbalances? What can I do to balance blood sugar? All right, so I assume you have some type of blood, if you're bringing up that question, because not everybody needs, most people won't bring that up unless if they have like insulin resistance, like an elevated hemoglobin A1C, elevated fasting insulin levels. So if you have insulin resistance, for example, you don't have to be on metformin, but if So if you have blood sugar imbalances, of course, diet, you always want to start with diet, and then, so start with diet, and you might need to, there are natural things you could take. Like there's been research about berberine being, just as effective as metformin. Now, problem is some people can't tolerate berberine, and it also has antimicrobial properties. So it's not something you want to be on. I do recommend berberine, but not something you want to be on real long-term, especially high doses. But, sometimes people need to take metformin to help with blood sugar and kind of break the cycle. And speak of breaking a cycle, it's not always going to break the cycle, because with insulin resistance is also inflammation going on typically. So you need to address the factors that are causing inflammation. So, yeah, and the challenge, I do have a lesson that focuses on blood sugar just because it is important. But those, and then I also have some articles on my website. And again, if you're taking Synthroid, not sure if you have Hashimoto's, but my book Hashimoto's Triggers, I talk about that. So there's a lot of different resources for that as well. All right, so CT, any reliable antidotes for chronic severe night sweats past age 65? So again, I wouldn't say there's an antidote like take this supplement and it's going to fix the problem. So usually there's a few factors that can cause that. So more commonly, sex hormone imbalances. Sometimes people with hyperthyroidism, that'll happen. So either way, so with hyperthyroidism, you need to address the thyroid hormone levels, do things to lower the hyperthyroidism. But with sex hormones, keep in mind you need healthy adrenals to have healthy sex hormones. And so so my focus is on adrenals. And even, past age 65, some will say, well, isn't it normal to have low sex hormones? And, without question, as both men and women get older, the sex hormones decrease, but they should still be within a certain range. And a lot of times what we see is they're not within that range. Like, for postmenopause, there's a postmenopausal range. Now in a blood test, there's a lot of times not a postmenopausal range. Like it might say less than, for progesterone, like less than 5, which, so suggesting that if someone has a progesterone of 0, that's fine. But there's other testing where they actually give postmenopausal reference ranges, like dried urine testing, for example. So yeah, I would always start by focusing on adrenals, because again, healthy adrenals important for healthy sex hormones. And all right, thanks, Sue, for so Sue attended the our last 21-day challenge. So she said, I really enjoyed the 21-day challenge. It was so informative, and Dr. Eric worked so hard to give us lots of information. It's great to get to know other people in the same situation. We help each other too. And then note to me, Dr. Eric, I'm no longer on medication since June for hyperthyroidism. When should I have another blood test? Apart from putting on weight, I feel good. It's very difficult to get to see my doctor in the UK during this difficult global time. Yeah. So again, Sue, as you can see, from the UK, United Kingdom. So people from pretty much, I won't say everywhere, not every country, but a lot of people from Europe, some people from Australia. The people in Australia could only really attend the evening coaching calls, but that's why I rotate the calls. And like I said, the daily lessons were recorded. But if you haven't had a blood test since June, Sue, I would definitely say do another blood test now. So when I was, and it's been a while, 2009 is when I was in remission, but when my first blood test looked good, I definitely didn't wait 6 months for the next one. I did another one at least like 6 to 8 weeks later, and did that a few times just to make sure things were stable. And then once things are stable, you could do like once every 6 months for a little bit, maybe for a couple of cycles. And then in my case, I usually do it once per year. Sometimes I'll do it a couple of times per year. But yeah, I understand with everything going on, same thing, United States, for a few months, we were having people not getting blood tests because I guess one reason, those seeing a doctor, maybe they weren't able to see their doctor in person, but even people who could go to a lab, like, in the United States, if they're a patient of mine, I could write a lab order, but they didn't want to go, understandably, didn't want to go to the lab to get blood drawn. So yeah, but I would say definitely, if you haven't done one since June, I would get one sooner than later. All right, so and those on YouTube, I will get to. We're going to go back and forth, so I'm going to answer a few more on Zoom, and then we'll get to those on YouTube. And again, apologize again for feel real bad for not clicking on the yeah. So, but all right, so. Desba, thanks for taking the time to answer these questions. I'm swinging wildly between hypo and hyper. Basically, every time I get a blood test, it's a different story. My endo seems to have very little answers. I am 3 weeks into doing the autoimmune protocol diet. I have a few energy crashes in the 3 weeks, but I feel okay. Hair is still falling out. Nails are weak, and the skin on hands and feet is so dry. Any advice? Yeah, definitely a lot to cover here, but so I'll try my best to give you a few things, and then I mean, the challenge I'll be talking, just plugging my challenge from time to time, but also in your case, you have a lot going on. You might want to consider working with a practitioner, but at the very least, a challenge to get more of your questions answered. But so, and also it's like when you say swinging wildly between hypo and hyper. So I don't know if you're taking anything, like if someone, like if someone's taking, if they're hyper and then they're taking antithyroid medication and then they become hypo and then the doses decrease and they become hyper again. So I don't know if that's the case with you. When you just say I'm swinging wildly between hypo and hyper, I don't necessarily know the full situation. I don't know if you're not taking anything and you're just going hypo and hyper. Again, that could be something like Hashimoto's, like I mentioned, where, someone, might actually be diagnosed with Graves, and maybe that might be the case, but they might have Hashimoto's where immune system, damages thyroid hormone gets released in the bloodstream, and then they feel hyper, but a lot of times that's transient, and then they become hypo. And again, so I would check out the article I wrote on my website, Hashimoto's, and just do a search on naturalendocrinesolutions.com. And then, so you're 3 weeks into doing autoimmune protocol diet, which is great. Have a few energy crashes in the 3 weeks, but I feel okay. Hair is still falling out, nails weak, skin and hands or feet are so dry. So, thyroid imbalances will commonly cause hair falling out, but also nutrient deficiencies. And then nails are weak, nutrient deficiencies, skin on hands and feet so dry. Again, nutrients like omega-3s, and not sure if you're in the United States, but there is you could do, well, even if you're overseas, you could probably do a fatty acid profile or omega-3 index. But yeah, so again, it's thyroid and nutrients, and there's probably other things too, but definitely wanting to do things to balance thyroid. And again, not sure about your situation, if it's autoimmune or so, assuming it is. This is a Graves and Hashimoto's chat, so I'm guessing most people on this have Graves or Hashimoto's, but there might be some people who join who have a thyroid condition that's not autoimmune. But again, so assuming you have Graves or Hashimoto's, you need to focus on finding, removing triggers, healing the gut, and autoimmune paleo diet, autoimmune protocol diet. It's one component. Like it's, there's, so diet is important, but it's not the only factor. So like during the challenge, for example, and not just during the challenge, but my articles, my books, I talk about diet, but that's not the only thing I speak about. I speak about stress, I speak about chemicals, I speak about infections, and other things too, just because so there are people who they eat well and they get dramatic results, and then there's people who are on a strict autoimmune paleo diet, for example, and they don't, maybe they feel a little bit better, but they still have a lot of problems. And that's telling us that there are other imbalances, other things we need to look at. So I definitely would dig deeper into finding your triggers, other underlying imbalances like nutrient deficiencies. All right. And all right. And okay, Desba also sent a video to. All right. And I guess the user is supposed to, okay, these are back to the caption. I'm seeing the question. So I guess it's the user, which I guess would make sense that the user, each individual user would have to, yeah, figure out the caption. So it's not a host generated function. Okay, glad we got some people who know a lot more than me when it comes to Zoom. So um, Tom Minix, the beach behind you looks fantastic. All right, so let's, and then one more from Carmen. He touches the three dots, top right, then settings, closed caption is a choice. Okay, so all right, so let's get to Carol and Carmen. You have a question, and then I will get to the YouTubers. And so, Carol, I've been battling Hashimoto since being diagnosed in 2015. I defeated all my symptoms except the antibodies, which recently almost doubled. TPO equals 400, thyroglobulin 600. How concerning are those antibodies if I feel fine? I am on no medications, but take thyrotropin, PMG, which is from Standard Process, and other gluten-free supplements, vitamins, minerals. I had the doctor order a thyroid ultrasound considering the high thyroglobulin marker for cancer, but it returned as non-concerning, just 2 non-specific nodules. So, so not sure. You said, okay, so TPO antibodies, and then yeah, there's thyroglobulin, and then there's thyroglobulin antibodies. So not sure if you had high thyroglobulin and thyroglobulin antibodies, which are two separate things. But either way, I mean, I do like to see those antibodies normalized, just because that they do mean that there is an autoimmune response going on, which isn't a good thing. It's not easy to lower antibodies, and I mean, I talk just about everybody. Just about everything I talk about during the 21-day challenge is designed to help people lower antibodies with the Graves and Hashimoto's challenge. But again, it's not something where it's going to be like, or someone's going to normalize their antibodies in 21 days or even a couple of months. It does take time. Again, you've been battling Hashimoto since 2015. So when someone still has antibodies, we don't have all the answers usually is the reason. So there might be missing triggers or underlying imbalances. Sometimes everything's been found and removed, but there's a chronic inflammatory process that we need to quench. And we can't underlook, like vitamin D, for example, which a lot of people on this probably know and probably have had tested for vitamin D, but there are others who don't test for vitamin D, and you do need to have healthy vitamin D levels to have a healthy immune system. A lot of people have healthy vitamin D levels and they still have elevated antibodies, so I'm not saying that alone. Just like selenium, there's some research that shows that selenium could help with TPO antibodies, but if you have one or more triggers that haven't been removed, if you have a leaky gut, then taking selenium, maybe it'll help a little bit, but it's not going to be, it's not going to solve the antibody problems completely. So that's where you, again, need a common response to probably a number of these questions is digging deeper, find remove triggers, heal the gut. And that's why, that is why I've done these challenges. There's I have books, I have, a lot of articles on my website, and there's a lot of other resources out there, I realize. But, when I did my first challenge, again, I didn't expect, really, didn't know what to expect. Didn't know if I'd be doing other ones, but just, it did give a lot of support to people for a very reasonable cost. Not exactly the same as working one-on-one, but some people just got so much value that, that's all they needed. Other people do, better working one-on-one, but again, just, more detective work. So whether it's joining the challenge, whether it's, working one-on-one with a practitioner, whether it's, doing some, reading some mine or someone else's books or, articles. So, yeah, so, and then, so Carmen here, So does a high quality curcumin oral capsule help with Hashimoto's inflammation? I mean, it could, but as I was just mentioning, like giving examples with vitamin D, selenium, it could help with inflammation, but you need to find and remove the source of the inflammation. If all you do is take curcumin, which I like curcumin, sometimes I take it. Um, I don't have any curcumin right now in my, cabinet, but sometimes I'll buy a bottle and be like, I'm going to take some curcumin. But yeah, so curcumin can help, and again, I do, recommend it to some patients, but you also need to find, remove triggers. And again, it's not just food. So if someone might be eating a real healthy diet, maybe autoimmune paleo, and taking anti-inflammatory supplements such as curcumin and having, healthy vitamin D levels, and they still have elevated antibodies and symptoms. And, because again, when that's the case, there are other things missing. All right, so I will get back to Zoom, but let's hit a few questions on Facebook. And again, Facebook again, since I didn't stream right away, one thing you didn't hear me say is I'm going to try to get to everybody at least once. So what YouTube, so there's definitely more questions on Zoom and on YouTube. I see there's one person who's asked about 4 questions. So I'm gonna answer one question for everybody at least, and then at least the ones who I've asked right now. There's right now 4 people who ask questions on YouTube, about 22 people on YouTube it looks like, but 4 people ask questions, but one asked 4 questions. But so I'm going to get to one of the questions from the one who asked 4, and then I'll go back to Zoom, because again, I want to make sure to get to everybody at least one time. That's my goal. And yeah, so there's a lot more questions on Zoom than on YouTube. So I know you might look and say, well, but those on YouTube, hey, there's not really a lot of questions, but on Zoom, as you'll hear me, ask those questions. Yeah, so we're probably going to be going. So I'm going to go to about 3:15 my time today. So a little, about what, 40 minutes or so. So Eugenia, what is the best way of eating for Hashimoto's, keto or AIP? So I like AIP, and usually that's a starting point in my practice, but there is no perfect diet for everyone. So that's just a starting point. If someone's a vegan, vegetarian, AIP is probably too strict, so we need to make modifications. Yeah, so I like autoimmune paleo. Ketogenic has some benefits as well. But yeah, I usually, autoimmune paleo is typically the starting point. And then we have Paul here. So percent of subclinical hypothyroidism, elevated TSH with normal antibody levels, well within the first half of reference range. So I'm not sure what your question is. You're asking the percent of subclinical hypothyroidism who have elevated TSH with normal antibodies levels well within the first half. Are you asking for the percentage of, like, what percentage of people have subclinical hypothyroidism? So, I mean, I don't know exactly, but I will say that the majority of people with Hashimoto's are subclinical. It's more common, definitely the patients I see with Hashimoto's, where their thyroid hormone levels are at least within the lab range. They might be outside of the optimal range, maybe on the lower side, but still most of the people I work with, they're not overtly low. They're not red flag as being low, both the T3 and T4. And then as far as you mentioned, um, okay, what normal antibody levels. Okay, so subclinical hypothyroidism. Okay, I guess I read it wrong. What normal antibody levels, but then you said well within the first half of the reference range. So normal antibody levels and TSH, like TSH well within the first half of the reference. I mean, most of my hypothyroid patients, I will say, have Hashimoto's. So usually, I mean, you could have Hashimoto's with normal antibodies, but most people have elevated antibodies with Hashimoto's. So, but if you're asking a percentage of people with subclinical hypothyroidism that don't, so those that don't have Hashimoto's, just elevated TSH, but slightly elevated, maybe like, like a 3, for example. I mean, Yeah, I don't know. I don't know. Yeah, I don't know if that's your question, honestly, but if that is, yeah, so you might want to clarify. But yeah, I don't know what. Again, most of the people I work with are, they and most people in general, most people with hypothyroidism, even subclinical hypothyroidism, have Hashimoto's. I think the percentage is about 90%, so maybe like 10%. But again, I can't say 10% of my patients. I mean, maybe, but it's not like I don't see any. I mean, I see definitely more non-autoimmune hyperthyroid patients. I see people with like toxic multinodular goiter, for example, but most of my hypo patients, there might be a few that are not autoimmune, but most of them are have Hashimoto's. But I guess in general, maybe like 10%. And but then again, how many of those are actually subclinical? I'm not sure. All right, so Linda has a question here. So for those, oh, okay, this is so Linda was helping Tom here and me talk about the closed captions. For those who are hearing impaired, if they have, so something a little bit different. For those who are hearing impaired, if they have an Android smartphone, and app called Live Transcribe can be downloaded from the App Store. I have it turned on to pick up the captions from the talks. That's interesting. Thank you. Thanks for sharing, Linda. All right, so KK here. I became hyper after going through a gut journey of 2 months. So I don't know, it's a Paragard and oregano oil, just for infections maybe. I ended up stopping thyroid medication for about a month until I eventually crashed to hypo. My antibodies have increased more than ever, even from diagnosed. Could the gut supplement play a role? And how can I work to reduce my antibodies? Okay, so this is kind of like one question. So last time my antibodies were checked 2 weeks ago, my TPO was over 300, and this person's been gluten, dairy, and egg free with limited soy intake. So yeah, so yeah, I mean, I guess oregano oil also, like I mentioned berberine earlier. I mean, I do recommend oregano oil, but it could also have a negative effect on good bacteria as well. So potentially could cause dysbiosis. I mean, I guess it depends. The Paragard, I'm not sure. I'm not sure about the other supplement because again, there's so many different supplements. I'm not sure what's in there, but oregano oil by itself, if you're taking real high doses, could be harsh if you take it for 2 months. I mean, most of the time it's not going to cause elevated antibodies. I mean, my guess it's something else. I mean, there's probably something else going on, maybe another infection. Maybe it didn't completely help with the infection. Just because we take antimicrobials for a few months, whether they're herbs or, I mean, usually antibiotics you're not going to take for a few months, but nothing's a 100% effective. So the only way to know if you got tested for a gut infection and, you followed a protocol. Yeah, I mean, if that's the only thing you did, maybe there is a correlation with the antibodies, but usually following an antimicrobial protocol isn't going to, increase antibodies. Could have stirred some things up. So I will say also, you might not want to just rely on doing an antibodies test right after that. And how could I work to reduce my antibodies? As I mentioned earlier, it's just, you might have other, just when I say earlier, some other people had similar questions, and, it's finding triggers, removing triggers, correcting underlying imbalances, healing the gut. And so, just, that's what you were trying to do, just maybe again, suspecting a gut infection, but maybe there's something else like heavy metals. Sometimes, if you have like certain environmental toxins like heavy metals, it can be difficult to eradicate certain infections. Even like a candida overgrowth can be more challenging if someone has heavy metals. So again, just trying to do more detective work, as I mentioned. To the same time, I don't mean to sound like a broken record, but again, I know it's general, like I said, with the others, maybe, visit my website and I have a lot of free articles, or take a look at my books. And or again, the challenge itself, just the challenge that's on the screen, consider, joining and to get more support. All right, so Linda, what about taking keto? So this is a different Linda, but yeah. So again, I start. I mean, everybody's different. I'm not so. I mean, keto is good, but autoimmune paleo is what I recommend. It's more specific for autoimmune, but I say that, but again, everybody is different. So it's not like someone needs to follow autoimmune paleo to heal. And so Paul, I'll just read this because this is maybe answering my questions, and then I'll get back to the Zoom calls or Zoom chat. So Paul says only list less than, so anti-thyroid peroxidase antibodies are negative, anti-thyroglobulin are negative, same as years ago when TSH was normal. So yeah, it sounds like you're not, I mean, it looks like you're not autoimmune, but so pretty much, yeah. So lower percentage of people in that situation where elevated TS, I can't say nobody. I mean, that not all cases of hypothyroidism are, including subclinical hypothyroidism, are caused by Hashimoto's. So yeah, I would say like 5 to 10%. It might even be lower than that as far as TSH. And again, it sounds like your TSH is in a lower, like it's not like it's super high either, but still something, does sound like something is going on. Also, if someone has depressed immunoglobulin, so IG, immunoglobulin A, B, no, not B, immunoglobulin A, G, or M are like common ones. But if they have like depressed, so what antibodies, it actually relates to IgG, immunoglobulin G. If someone has depressed IgG levels, that could lead to false negative antibodies. So you might want to test the immunoglobulin G just to make sure it's looking accurate, but yeah, definitely lower percents of people. Okay, so I'm gonna go back. I'll get back to YouTube, but as promised, I'm gonna jump now to Zoom, and again, I'll go like another 30 minutes. And again, I probably won't get to all questions, but I will try to get to everybody at least one time. So and try, if I answer someone's question more than once, it's just because I forgot that they asked a question. But again, I'll try to get to everybody once, and then maybe there'll be time to get to everybody twice, but I'm not sure, or those who have more than one question. So oh, actually, Carol, so I answered yours, and then so here we go, Carolyn. So I have Hashimoto's and struggle with lower blood pressure. It has gone as low as 87 over 49. One doctor said it could be adrenals. How can I support my adrenals to increase my blood pressure so I don't feel dizzy and unenergetic? So yeah, I definitely would test for adrenals. And so, I mean, again, I can't tell you like specifically what to take, but I can tell you that so someone, it sounds like low adrenal like licorice root. Again, the licorice root, if someone has high blood pressure, they definitely don't want to take it because it can increase blood pressure. But yeah, if your upper number is as low as 49, that's really, that's really low. So you might also, I don't know if it was your medical doctor, but like if the systolic was 49, I don't know if I've ever heard of that being low, being that, that low. The bottom one's diastolic, even that's low for that. But again, definitely look at adrenals, and maybe in your case, since the blood pressure is that low, usually I recommend salivary testing for adrenal, saliva testing, or dried urine testing. But I definitely would look into, if your blood pressure is that low, I would do some blood testing, do like ACTH, like just, again, if you're seeing a medical doctor, they might, maybe they did refer you out to an endocrinologist, just rule out something like Addison's. Again, not to say that's, that's probably not the case just with low blood pressure, but like I said, that is really low. And so, licorice root is something I took. Again, I can't tell you specifically to take it, but, again, low adrenals, and that does increase blood pressure. And then B vitamins, vitamin C, sometimes an adrenal glandular. right, so let's all right, Brock, I'll go ahead and answer this because it's kind of like a continuation because you're just like of your first question. So I had heart palpitations a few years ago and I took iodine to get rid of it. It worked, but then I started consuming 10 drops a day of iodine. And after 3 weeks, it threw me into severe hyperthyroidism. Now, anytime I have anything with iodine salt, it throws me into the same problem. And it lasts anywhere from 10 days to 3 weeks. Some foods high in iodine can cause it too, but I have to consume a lot of it. Naturally occurring iodine does not hurt me nearly as much as added iodine. Yeah, I would get the antibodies tested. I would test, I mean, probably all three, but definitely thyroid peroxidase antibodies and anti-thyroglobulin antibodies. But it's probably worth testing thyroid stimulating immunoglobulins, which are associated with Graves. But again, I suspect possibly that maybe Hashimoto's, and then when you took the iodine, it caused a Hashitoxicosis situation where hyperthyroidism, pretty much immune system induced hyperthyroidism, which is, I mean, Graves is but with that, again, it's Hashimoto's with hyperthyroidism. So it's not exactly the same as, it's actually not Graves. And again, visit my website also for more information. I wrote an article, I think it was last year, a year or two ago, on Hashitoxicosis. But I definitely would look at those antibodies. And Cheryl, so Cheryl, can Graves' disease with almost undetectable TSH cause any issues with elevated red blood cells or oxygen issues? Have not started any treatments. Thank you. Well, I mean, most people with Graves will have undetectable TSH. So that's not, that's pretty common. So most will have really low TSH, or again, it will say less than, it might be like 0.00, might be 0.01, 0.02, or less than 0.005, for example. I mean, it's different, but either way, it's usually going to be really low. I mean, it could. I can't say commonly when seeing a CBC, it won't commonly cause elevated red blood cells, and there's other factors like dehydration that could cause red blood cells or oxygen issues. I mean, I will say this though, if you are hyperthyroid, I mean, regardless of what the blood tests look like, you want anybody who has hyperthyroidism, you want to don't underestimate the impact of elevated thyroid hormone levels. So just, you want to be safe while, if someone doesn't want to take medication, which is fine. I took the herb bugleweed when I was dealing with hyperthyroidism. And of course, if someone wants to take medication, that's fine too. I work with people on methimazole or carbimazole or PTU. But yeah, so if you're a hyperthyroid, whether or not it's responsible, even if if it's like, other things that's causing, elevated red blood cells or, oxygen issues, you still, of course, want to address the hyperthyroidism and do that sooner or later. Okay, so I was long-term Hashimoto's on 150 micrograms with no complaints until a PCP thought I was turning hyper and lowered my dose. That's when the night sweats began. Every time they lowered again, night sweats and day. Okay, so that's TT that had the night sweats question. Yeah, so yeah, I mean, it sounds like, 150 micrograms, that's a lot of thyroid hormone, but maybe you needed that, maybe you don't. I would need to like see your blood test to kind of get an idea. Again, I can't, of course, tell you like to lower or to take more, but if looking at your numbers of, if I look at someone's numbers, I could say, just, yes, I would go to your prescribing doctor and have this, have him or her do this. But so there's ways around it without me telling someone like directly to do this. But if you're, if you were reduced to 125 micrograms and, if you, were more on the, like, let's say your TSH was 3.5 and your free T3, free T4 were within range but less than optimal, again, some doctors look at that and say, hey, it looks fine because you're within range, but you know, at TSH of like 3.5 is not optimal. So, but that's, yeah, it does sound like it might be related to thyroid, since you mentioned when lowering thyroid hormone, that's when the night sweats began. All right. So once again, Brock, yeah, I would test antibodies, read my blog post on Hashimoto's. All right. So Carmen, my doctor gives me a hormone test, saliva test for hormone measurement. I get very thorough results. Okay, cool. Well, thanks for sharing. Yeah, I mean, I like saliva testing. All right. So Laura Lee, so I don't think we've answered a question from you. Does the pink Himalayan salts have adequate iodine? I had high for 3 years and took methimazole, getting lower and lower until now at the lowest, being off of it, the med for 6 months, very tired, have used the pink salt for 2 years. So you had high, you mean hyperthyroidism? Okay, yeah, I had hyperthyroidism and took methimazole, and then very tired, having used the pink salt for 2 years. I mean, I'm not sure what, I mean, I don't, so, I mean, it depends, I guess, what you mean by him. So I actually, for a while, yeah, the pink Himalayan, I forget how much iodine is in there. So I was under the impression a very low amount, but then I heard another practitioner talk about pink Himalayan. I mean, so, you know, the question is, should you take pink Himalayan or not? But and again, that is something I commonly recommended, either Celtic sea salt, which doesn't really have hardly any iodine. Pink Himalayan does have, you know, apparently more than I thought, but again, I'm not sure how much. So the question is, should you take it, which is what you're asking, does it have adequate iodine? Like, you think you might need more iodine, but you might not. So just because you're very tired does not need, getting lower and lower until now at the lowest, being off. So you've been off the medication for 6 months, very tired, have used a pink salt for 2 years. Again, I don't think the problem is that you need more pink Himalayan salts. I mean, maybe you need more nutrients, but for example, you know, if you're lower in, you know, like an iron, like you have an iron deficiency, taking the pink Himalayan salt is not going to be the solution for that. Or if you're low in B12, then that definitely won't be the solution, because it's not going to have any B12 in there. So if there's certain nutrient deficiencies, so more, maybe do an iron panel. Adrenals could be a big problem. Again, the methimazole, as you know, it's important to manage the symptoms and be safe, as I mentioned, but it's not doing anything if someone has problems with adrenals, if someone has nutrient deficiencies, if someone has an infection that's causing fatigue, problems with the mitochondria. All right, so Danielle, all right, so let's see. My 11-year-old daughter has both Hashimoto's and Graves. Last year, Moducare, which I assume is, I think I heard of it. I guess it's a supplement that modulates immune system. And then a gluten-free diet brought her antibodies down from 700 to 400. Since COVID, non-compliant diet, off Moducare, her Graves has gotten worse. Recent labs, I assume you meant labs, show antibody, yeah, maybe it's anyway, so recent labs show antibodies over 900, weight loss and hyper, trying Thyrocalm, which is by Herb Farm. Lemon balm, holy basil at night, has a lot of trouble sleeping, very poor focus, hyper, not bulging eyes, but lack of stamina, even though hyper was treated for Lyme 2 years ago. What else can work for her? Recent labs, recent labs, not loans. Yeah, no, I get it. Also, her reverse T3 is very high, as is free T3 and free T4 and free T3. So yeah, so hyperthyroidism, it's going to be, that's what hyperthyroidism, free T4, free T3 elevated, and reverse T3 is commonly elevated. And so yeah, I mean, diet is important. So again, you mentioned non-compliant diet. Diet isn't everything, but if someone's not eating a healthy diet, it definitely could be a factor. So that's definitely a place I would, just try to get back on track with the diet. And, 11-year-old, I mean, I have a 15 and 13-year-old, so I know it's not easy to get them to follow a strict diet. And in, your case, it sounds like gluten-free and then dairy-free. I missed that. So GFDF diet, so gluten-free, dairy-free diet. And again, there could be other things like corn, is a common allergen. Nightshades, which, as I mentioned, very difficult for anybody, let alone an 11-year-old, to follow the diet. But, then the Lyme, I mean, so again, I could tell you from self-experience, because I, dealt with chronic Lyme in 2018. I was diagnosed, and, it's, Lyme, other infections could be a factor. So, yeah, I mean, I definitely would start with diet and nutrients, nutrient deficiencies, things that you could do in 11. I mean, you could do anything in an adult, well, not anything, but, it's just try again, at least gluten, dairy free, maybe corn free, just, autoimmune paleo diet, like I said, is a starting point, but it might be real difficult to have your 11-year-old to follow. Even gluten, dairy free, corn free, it will be difficult for her in all likelihood. But then, just make sure block out time for stress management, important for children and teenagers as well, not just adults. And work on things for detoxification, maybe make smoothies, because, she's like most children, she might not like to eat a lot of vegetables, but you could mask some vegetables with a smoothie, do things to support detoxification. Because again, with Lyme disease and other infections, if you have, I mentioned earlier, like heavy metals or, other toxins that could, make it more difficult when dealing with infections. So yeah, just, I mean, it comes down to, finding, removing triggers. But again, diet, lifestyle is big, but also finding, removing triggers, healing the gut. So again, not easy. Again, you might want to consider the challenge enrolling in the, your daughter probably won't want anything to do but again, it would be more for you than your daughter. I mean, it's for your daughter, but your daughter, at 11 years old is not gonna, just watch the video lessons and participate in the calls, but maybe, you could get more answers. Again, working one-on-one with a practitioner in this situation also. So, but yeah, both Hashis and Graves. So again, there's overlap when it comes to, I mean, they're both autoimmune conditions. And if you visit, actually, I'll need to put it on Facebook. Oh wait, no, actually, it wasn't a video. My last blog post from Thursday, I wrote a blog post, similarities and differences between Graves' disease and Hashimoto's, which you might have watched, but if you didn't, definitely check it out. But a lot of overlap, obviously, the symptom management of someone, it sounds like she's more hyper. So doing things, like the thyroid calming formula might help, but there might need to, if that doesn't work, I believe that's, so Herb Farm, there's a few different ones, thyroid calming formula. I forget now if that's the same as thyroid calm, but, all right. And I apologize, the phone, I'm in the office now. A lot of times I do these from home, but I'm actually in my office, and even though it's Saturday, the phone's ringing. So hopefully nobody will will leave a message, or else you'll hear that on this call. But anyway, Danielle, so yeah, I would say, try to do as much to, get the symptoms. I was talking about thyroid calm, just make sure that she's safe. You want to get those thyroid hormone levels down, and thyroid calm is good quality, like Herb Farm's good quality, but lower potency, like 1 to 5 extracts. Usually I recommend like 1 to 2, but sometimes 1 to 5 could work. All right, so let's, and again, just, all right, so Lori, so I don't think I answered a question. You did mention you were from Chicago earlier, but I don't think you actually had a question. So, so have you done any research on castor oil packs, the science behind castor oil? No, not really. I mean, I've done I know castor oil packs, can potentially work for different health conditions, like maybe thyroid nodules, but and then other health issues. But no, I can't say I've done like research as far as the science. That is interesting though, so that's maybe something I could look into for, actually I'm going to write that down. Maybe, probably not this year, but maybe a 2021 article. I don't even know if they know, like with some of these things, like there's no like, I won't say there's no science, but there's nothing like in the research or, so it's just like coffee enemas, there's not a lot in the research. So that some will say that coffee enemas will increase glutathione, but there's some controversy over that. So, but again, coffee enemas, a lot of practitioners recommend that, like Gerson therapy for cancer recommends that. So Teresa, what do you think about using a whole foods plant-based diet as treatment for Hashimoto's? I mean, it could work. I recommend autoimmune paleo, but it's mostly a plant-based autoimmune paleo. So I'm not recommending, some people eat a lot of meat, just they feel hungry, but probably because they're not eating enough greens. But yeah, I think that like I personally, I'm not vegetarian or vegan, but I'll have meat like once per day and it's a, small amount. And some days I go without meat. So, so yeah, I think as long, the big thing is trying to make sure you're getting enough plant-based foods, enough a good variety of vegetables. If someone's eating 4 or 5 different veggies per day, that might not be enough. I'm sorry, 4 or 5 servings, but also not just, so servings, and then there's, sometimes I mentioned that I've been in 2018, so 2 years ago, I attended an online webinar, or actually an online, not just a webinar, it was I think it was either 4 or 6 week online course, Dr. Jason Horlick, and he's a probiotic expert. And yeah, so he talks, so he spoke about trying to eat 40 different vegetables per week. Again, not servings, but different types. And I think it's safe to say most people, including myself, don't eat 40 different types, but yeah, I guess 20 different per. So if you're, honestly, if you're eating, because if you're like me or like, I might eat like anywhere between maybe like sometimes like 7 different vegetables per day, but I have those vegetables for a few days. So, I want to use up those vegetables before using, getting others. So it's not like I'll have like, yeah. So anyway, so I might eat, 15 to 20 different types of veggies, making a few trips to the, to get fresh vegetables each week. But yeah, 40 is a lot, but yeah. So like I said, yeah, I definitely recommend eating a lot of plant-based foods. All right, so Brock, yeah, actually, Brock asked, will you post a recorded version of this? So yeah, it's recording to YouTube. Again, the first few minutes got cut off, but I didn't. There was no Q&A. It was just me talking about Zoom, which doesn't benefit those on YouTube anyway, and then the challenge. So what I'll do is I'll send an email with the link to YouTube, because again, anyone, like with, not everybody here is on Facebook, but YouTube, you don't need to like be on. Yeah, so or you could visit my website, my YouTube channel, Natural Thyroid Doctor. Sometimes it doesn't post until the next day. So even though it's recording right now on YouTube, it might not be on there until the recording might not be in there. But yes, it is recording. And then Myrnia, should thyroid sufferers avoid dairy products? So I do recommend for those with Graves and Hashimoto's to, at least while restoring their health, to strictly avoid gluten as well as dairy. Corn is another one. Again, autoimmune paleo, excuse me, quick sip of water here. Yeah, I've been this morning, reason why I'm in my office, I've been doing a bunch of recording for the upcoming challenge that I'm having. So it might be time. Yeah, I'm going to be giving my voice a break in just a few minutes, but Yeah, so I recommend, as I mentioned earlier, autoimmune paleo is a starting point for my Graves and Hashimoto's patients. And so they're avoiding not only dairy, but pretty much grains, gluten, grains, eggs, nightshades, very difficult diet to follow. But like I said, it's a starting point. So yes, I do recommend those. Even if someone had non-autoimmune, I would say at least avoid like gluten and dairy. Okay, and Daniel, you are very welcome. And also you added that my daughter tried methimazole but did poorly with joint pains and had high liver enzymes. So yeah, so I can understand trying the thyroid calming formula. So I took MediHerb Bugleweed when I was dealing with Graves, and not all my patients take that. I mean, some of my patients will start out with Herb Farm, and if they're doing well on that, they'll stay on that. If it's not managing the symptoms, then they'll move to something more potent. All right, so let's go to YouTube, and there's a few new people asking questions on YouTube. So let's see. So Yash, can you describe more about resistant thyroid syndrome? I discussed it with my endocrinologist and physician about elevated free T3, but they're not listening to me. I have all disease tests with normal levels, but I have 115. Her heart rate is 115 beats per minute. They just prescribed multivitamin. Yeah, so thyroid hormone resistance, I do have an article on my website on this. It's not common. I can't say I see a lot of this in my practice, but that is when TSH will be normal or elevated. Free T4 will look good, and free T3 is elevated. So again, it's not hyperthyroidism, because hyperthyroidism, you have depressed TSH, and usually you're going to have elevated free T4 and free T3. With this, TSH is normal, sometimes high, free T3 is elevated. And so with this, they have with elevated with thyroid hormone resistance, you have a lot of thyroid hormone, but it's not all of it's getting into the cell. So similar to insulin resistance, where you have a lot of insulin, but it's not also getting into the cell. So things like zinc, vitamin A, are things that could help. Like you're looking to support the thyroid receptor, the thyroid hormone receptor, and just nutrient deficiencies. Just making sure correcting nutrient deficiencies, really important with thyroid hormone resistance. And you want to be safe though. If you have a heart rate of 115 beats per minute, you might want to consider like looking into something if your medical doctors don't recommend. Thing with bugleweed, I don't know if I would take anything anti-thyroid, just because again, your TSH is looking good, and your free T4 is looking good, and something like bugleweed would also lower TSH. I can understand not taking anti-thyroid medication, but maybe something in the meantime, definitely like, consider something like when someone has, in my practice, elevated heart rate, and let's say if thyroid hormone levels look good, I would say take motherwort or take hawthorn, for example. Multivitamin, of course, isn't going to really do anything. Nutrient deficiencies, but that's probably not why they gave it, is my guess. They probably just said they didn't know what else to do. And then if it's a regular multivitamin, if it's a high potency, might help. But again, you probably won't have enough vitamin A and zinc. Again, vitamin A, of course, you want to be cautious, although many people short-term do fine. Most people do fine short-term with higher doses of vitamin A. If someone possibly will be getting pregnant, then I would recommend not taking massive doses of vitamin A, even short-term. All right, so this person here, I have Graves for 5 years now. I stopped going to my endocrinologist 3 years ago because I do not want to radiate my thyroid. Is it possible to have a thyroid either? Oh, is it possible to have a doctor either on the internet or by phone? Yeah, there's, a lot, especially in 2020 now, a number of practitioners, so I live in a small town with few options. Yeah, a lot of practitioners now. I've done remote consults through like phone, Skype, Zoom. More recently Zoom. Honestly, years it was just Skype, but I've been doing it for over 10 years now. But now, especially even before the COVID, there were more and more doctors doing remote consults. So yeah, so you could definitely find, I mean, again, there's me, but there's others too. I'm definitely not the only one. I will say with Graves, there's not a lot of doctors that focus on hyperthyroidism. There's definitely more that focus on hypothyroidism and Hashimoto's. Um, but yeah, so there's definitely options to work with someone remotely. I mean, pretty much, now definitely all my patients are remote with COVID. I haven't had anybody come into the office, you know, maybe early this year, but even before COVID, most of my patients have been remote, people in different states, different countries. So, it's definitely possible not only to work with someone remotely, but to get good results. All right, so John, I have a large nodule, 4.5 centimeter left side, had MRI, ultrasound, and a biopsy. Doctor says I have Graves and one entire thyroid removed. Can anything reduce size of nodule or keep it from growing? So I don't know if they tested the thyroid stimulating immunoglobulins, just, like how they confirm that you have Graves, but I mean, that is a large nodule. 4.5 centimeter for a nodule is pretty big. So, I mean, most nodules, we're looking at problems with estrogen metabolism, insulin resistance. So even though you're a male, it doesn't mean that you can't have problems with estrogen metabolism. So, I mean, in my practice, I do dried urine testing to look at estrogen metabolism. You could also do testing like in a blood for total estrogens to look at levels of estrogen. That's not looking at estrogen metabolism. But if you have high total estrogens, you probably have problems with estrogen metabolism. And so just doing things to support estrogen metabolism, food-wise, plenty of cruciferous vegetables, which I know some with Hashimoto's have been told not to eat them because they're goitrogenic, but that's, yeah, most people do okay with goitrogenic vegetables, with cruciferous vegetables, I should say. And broccoli sprouts really good. Supplement wise, diendyl-methane or DIM. And then insulin resistance, just blood sugar, control inflammation. Someone mentioned metformin, which isn't my first choice, but if in your case with 4.5 centimeter nodule, if you do have insulin resistance and you try, like time's not on your side where you need to like you might not be in a rush to get surgery, and but if you're having any type of obstruction, so maybe look into metformin, but I usually try to do things naturally: insulin resistance, blood sugar. All right, so I'm gonna go just another few minutes here. All right, because I pretty much got to everybody almost. I think there's a few people I've not gotten to on Zoom. So Myra and Annie. Okay. So Myra, I have slow motility, so I'm not regular. AIP diet or low carb doesn't help me. I notice green leafy vegetables slows my digestion. What do you think is a better approach? I have Hashimoto's. I take 60 milligrams of Armour Thyroid daily. So, I mean, I would try to look into the cost, not just try to find, I mean, obviously there are things like magnesium. You need to make sure you're getting enough magnesium. And I wrote an article. Also, check out my website. There's a blog post I wrote on AIP diet and constipation, because I mean, if someone is eating, and there's also there's another article on, and that is a problem with ketogenic and autoimmune paleo is, again, a lot of people are eating really low carb, not getting enough fiber in the diet. Green leafy vegetables aren't really a good source of fiber. Usually, other vegetables like cruciferous vegetables, are better. But there's an article where also I wrote fiber on fiber and short chain fatty acids. So like, AIP friendly sources of fiber. And again, so the green leafy vegetables aren't really a good source of fiber, but again, also make sure obviously well hydrated, magnesium, that you're not magnesium deficient. And then, just gut dysbiosis, like I'm not saying you have SIBO, but small intestinal bacterial overgrowth, can cause slow motility, or it could be associated with slow motility. Like if you have problems at migrating motor complex, that is actually what's causing the SIBO and the slow motility, so the SIBO not necessarily causing a slow motility, but maybe looking into that. It depends also, especially if you're having symptoms like gastrointestinal symptoms, like bloating, gas when eating certain foods, like, broccoli, for example, or fermented foods. All right. So Annie, so what do you think of T2 supplementation, and apart from weight loss, how can it benefit? So not sure if that's new. I know like desiccated thyroid, it also has not only T3 and T4, but it has T1 and T2. But I've not heard of, that's another one I'm going to actually write down, because I've not heard about T2 supplementation. So I cannot give you an answer right now on that, Annie. But I'm going to actually do some research and see, because I've not, like I said, I'm not familiar with even the companies that offer that. All right, Sandra from Canada. All right, so we have, oh, okay, so I think she means T3 supplementation. Yeah, maybe. I mean, yeah, I don't know. That's, yeah, T3 supplementation. Let's see, is there another? No, Annie means T2. So yeah, so so I'm not sure. So there's a question from Myrnia on Zoom and Ivy on YouTube. So I'm going to answer those. Will be my two final questions, and then I'm going to call it a day. And so Ivy asks, do you recommend to remove the thyroid that has small nodules? I do not. I'm not saying there's never a time and place, but for smaller nodules, usually not. So especially less than 1 centimeter, usually, I mean, there's always exceptions, but most of the time they won't even biopsy them when they're less than 1 centimeter. And, a lot of people have nodules that aren't causing problems. So my answer would be no to that. And then Myrnia also has a question on thyroid nodules. So please give more details on shrinking thyroid. Well, she said thyroid lumps, or, thyroid nodules naturally. And, as I mentioned before, addressing estrogen metabolism, insulin resistance are two of the main things that I recommend. So, so it's not, and again, I will say, it's not always easy to shrink that. I mean, just like antibodies, but even with thyroid nodules, we'll have, the only way to really know is by doing a follow-up ultrasound, and we'll have patients do that. And sometimes, the thyroid ultrasound will show that the nodules have decreased significantly. Sometimes they don't decrease. Sometimes they're completely gone. Even when we're addressing like estrogen metabolism problems. But I have articles on my website during the challenge, the upcoming challenge, one of the pre-training lessons. So one thing that's not on the slide with the challenge is when you join, you get access to 5 pre-training lessons. So one of them one talks about thyroid nodules, actually. One talks about managing symptoms like, bugleweed, antithyroid medication, thyroid hormone replacement. Again, not T2, because I got to do research on that. And another one goes into the diet. So it goes into, autoimmune paleo, if someone's a vegan, vegetarian. And then there's another presentation that why people don't get better, another pre-training on thyroid eye disease. So you get access to the 21-day challenge. Doesn't actually start until a week from Monday, November 2nd, but you get access to some pre-challenge training lessons, including, again, nodules. That's why I'm bringing that up, just because there's a few questions on nodules. But I also have some information on my website for that as well. And all right, so Sandra, will I ever get better? So, I mean, there's, so I had Graves. I got better. I got into remission, and I've worked with a lot of patients over the years with Graves and Hashimoto's that have gotten a remission. I can't say 100%. No doctor has 100% success rate, and a lot of times that's when someone doesn't get better. It's not following the recommendation strictly. Again, during the challenge, so of course I'm going to recommend for pretty much everyone with Graves and Hashimoto's to join the challenge. So again, one of the pre-challenge lessons, I talk about why some people don't get better, like the roadblocks they hit. But obviously there's a lot more than that. So, and Ivy, you are very welcome. So for those who trickled in late, I'll say, and then I'll say my goodbye. I'll just give one more rundown of the challenge. So again, 21-day Graves and Hashimoto's challenge. This is my third longer challenge. I did have a free 5-day one in August, but I've done a couple of longer ones, and just the longer ones, I just realized I think maybe my head is getting cut off possibly. I don't know. Or no, maybe it's just my computer. No, that's fine. So starts on Monday, November 2nd, a week from this Monday. But again, you get access to 5 pre-training lessons immediately. And the goal is really just to try to help you get on the path to finding and removing your triggers, correcting underlying imbalances, healing your gut. So every day there'll be a pre-recorded video lesson. And so once again, it doesn't matter where you live. So you could watch those lessons at your convenience. And then there's 21-day daily priority action steps that go with those lessons. And then there's daily calls, 21 days worth of calls. Now those are live, and same thing with weekly 90-minute Q&A sessions. Those are live too, but I rotate the times to accommodate those in different time zones, either 1 p.m. or 8:30 p.m. Times may vary slightly, especially with the 1 p.m. It might sometimes be 12 or 12:30 Eastern time. And then with the Q&A sessions, you could email questions. And like I said earlier, almost with both of the challenges, I think I answered pretty much every question, so again, it's not like these calls, I get a good amount of questions on these calls, just not all the questions, but I make every effort. And again, I can't say that every coaching call I'll get to every question, but by the time the challenge is up, especially those Q&A sessions are like catch-up sessions. So, and then again, there's 2 communities, one on Facebook, one off of Facebook for those that are not on Facebook, so you could engage with each other. And I have a free Facebook group that's over 2,000 people right now. So just by comparison, the last challenge, the first one, there was no Facebook group. So the last one had 100 people in the Facebook group, and probably about maybe 30 of those people. Again, I don't know if Sue is on there now, but Sue mentioned earlier she was part of the last challenge, so she was part of the Facebook group. And again, there was a lot of people on there, but maybe about 25, 30 regulars, just communicating. So again, you definitely get to know people. If you want to know people, as I said earlier, if you don't want to know people, then you can just take advantage of the lessons, the priority action steps, the live calls. And again, the cost is $49. Which again is, to me, it's a no-brainer. I know 2020 has been a rough year for some people, but $49, just the amount of support you get, the amount of information you get, and optional, you could get, it's a $50 upgrade to have a one-on-one find your food triggers call with one of my nutritional health coaches, Carson, Tracy, both of them are awesome. So, and again, visit this website and check out, there's a bunch of videos. There's also screenshots. I did the calls on Zoom, and so I took screenshots of people in the chat who were raving about the challenge. And, I did the same with Facebook and the Facebook group, but then I also have a number of videos. So for more information, visit the website thyroidhealthchallenge.com/enroll2020. And also the email I sent earlier today has that link. So I forgot to mention that. At the email, on the bottom of the email, the PS, it has that link. But that is it. So let me, and I see Sue now. She's still on there. Hey, Sue. Yeah, I have going back and forth between YouTube and Facebook. I don't see, I have like Zoom minimized here. So, but I'm going to stop the share now, and then we could all say our goodbyes. Let me see. All right. So if anybody wants to say, if you want to say goodbye, in the challenge, it's a thing to unmute yourself and say goodbye. But the very first challenge, I was able to unmute everybody, but I think this that option is not available for. But looks like a few people have unmuted. But anyway, thank you, everyone. Thanks for joining. Thanks for your questions. Hope to see some of you in the next upcoming challenge. Thanks, Sue, for your, for letting everyone know about your experience with the challenge. And again, I probably will be doing another one next Saturday. I think I will be. Again, it's going to be crazy because it'll be only a few days before the challenge. But I probably will do another live one around the same time next Saturday. So, but again, have a great rest of your Saturday, a great rest of your weekends. And again, maybe I'll catch you next week, and maybe I'll catch some of you in the challenge starting on November 2nd. All right. Again, take care, everyone.
Bye.
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 Thank you.
Thank you.
Did it show?